This is Chris Kelly with 3 key tests to determine your client's potential to develop a six-pack. Now, when we're thinking about toning our muscles, the 2 factors that are most important would be the position of the pelvis, okay, whether or not we're in the proper alignment to properly define our abs, and as well whether or not your client can maintain an abdominal brace and use their abs correctly. All right, if either of these things are not the case, these are the first things we want to address in order to get them in the proper alignment and awareness to use their abs correctly. All right, so with that said, when we're looking at pelvic alignment, all right, the first thing we're going to do is kind of do just a spot muscle test. All right, oftentimes we find with clients that wear heels or their hips are tight, we have a tight either psoas, what we call the rectus femoris, where the front of our legs are excessively tight. We get our clients into this anterior tilt where their pelvis is tilted backwards, so when they're doing this crunch or leg lifting movements, whatever it may be, they have an excessive arch in their back and they can't really, the lower back and kind of the hip flexors tend to do a lot of the work. To spot assess this, what we like to do is just get our clients on their back, and ask them to just pull their heel to their butt. All right, what I'm looking for here is the position of their pelvis. All right, I'm going to tell the client to try to keep it flat against the floor, but as they're flexing back, if I kind of see it arch up like this, I know that they're compensating, and that's kind of the active range that's kind of the end of their range of motion there. I mean, if the client can get their heel to their butt fully, while keeping their pelvis on the floor, we know that they're good to go, that they're in the proper pelvic alignment. However, if we see their pelvis start to move before that's the case, or they can only move it to around here, the next step would be for the trainer or whoever's testing just to kind of press down and get kind of a feel of this. All right, is it kind of a hard feel, or can you push it back? All right, so if it is hard, then we know that the client is in some degree of anterior tilt, and this is a muscle that we want to stretch. All right, in order to do so, we can simply employ a simple half-kneeling hip flexor stretch, where I come into this position, grab my back leg. You can also get up against the wall or put your back foot on a step. Just lean forward. You can have the client rock back and forth in this position, mobilize really before your session to work this area out. All right, immediately afterwards, we would do both sides, and then we would go into a single leg glute bridge, knee to the chest, push it up, tighten the butt cheek, hold, come back down. Again, look for about 15 reps. So we're stretching the tight muscle, and then we're strengthening the antagonist to kind of get everything working, to loosen these areas up and get that pelvis into proper alignment. All right, for our next test, all right, the thing that we're going to look at is whether or not the client can maintain an abdominal brace. And in order to do so, I'm just going to have them come into a plank position here. They're on their hands. Tell them to get the back flat. And I'm just going to ask them to, just try to keep everything flat, keep their abs tight, and raise it up. All right, I'm just going to have them hold for 30 seconds here. Not really going to say much to them, but I'm going to look at 2 things. All right, I'm going to look at whether or not they're kind of collapsing in the midsection here. As well, I'm going to be asking them, where do you feel that? All right, if they're telling me in their arms, in their feet, anywhere other than their stomach, okay, I know that they're not maintaining proper abdominal bracing. So immediately, if you ask them, okay, tighten your abs. Okay, you feel anything now? If they say no, okay, we know that there's something going on there, and they need a little bit of facilitation. Okay, and with facilitation, one thing that we like to use to clean this up would be a mini band. Okay, depending on the client, I can either have them put this around their wrists here, or what we like to do actually is put it around the feet, bring it up to around the knees. All right, what I'm going to do now, again, I'm going to cue the client, press into the ground, press the mini band out, really tighten your abs, tighten the butt cheeks, and this is just going to help to develop a little bit of compressive loading on the stomach and on the abdominals, help to kind of the client to brace a little bit better. And oftentimes this is going to really help them to tighten their abs and feel it in the proper place. And we're not trying to really train the abs here in terms of strength, we're just facilitating. We're getting them to be able to feel it, and we're getting that connection to their mind as well. All right, we can try this in several positions. We like to use the knees. We'll put it around the feet or the ankles as well. And you can also put it around the hands. If it's a client with issues with their shoulders, what we can ask them to do is just put it around the wrists here. Spread the hands out. Abs are tight. Really the same concepts apply. Surely, helps the client to brace from various positions and is a good warm-up drill before your core training session. Now for our last test here, we're just going to test the strength of the lower abs. All right, this is called a leg lowering test. All right, what I'm going to do is just ask the client to cross their arms, raise their legs up into the air, count to 10, and slowly press their back into the ground and slowly lower their legs. Okay, as a trainer, I'm going to be putting my hand under their back here to maintain pressure. All right, I'm going to see how far they're able to come down while maintaining pressure. All right, I'm going to tell them to stop where their back starts to arch. All right, and that's going to give me a general indication of how strong their lower abs are. All right, for people that arch right at the beginning or unable to really maintain that at all, we know that they're going to need a lot of direct strengthening for their external obliques, their lower abdominals in particular. So this is definitely an area we want to prioritize by training. We know that a lot of people do a lot of sit-ups, crunches, and things which involve movement from the the chest to the knees, and oftentimes we want to address this imbalance by doing what we call the 2-to-1 ratio. You know, for somebody that's really weak in their lower abs, I'm going to do twice the number of dead bugs or knee to chest exercises that I would any sort of torso flexion exercise where they're sitting up. So those are just some simple tips to help you assess your clients, some corrective things to really work on those areas, and hopefully that's of use to you in your core training routine.